Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Wiener.
Okay, we got a really cool episode today.
Okay.
We're going to talk about the top 5 ways to know that the medical information you're getting online is reliable.
So I think that's an easy one. Just use our website.
Whoa, Talking with Docs. Thanks for watching. No, and you can apply these questions to any video that we've made.
Absolutely.
Please do.
Yes.
Because these are the best ways to know that your information that you're getting on, because there's a ton of information out there.
Oh my goodness.
You want to make sure it's reliable.
Yeah.
Okay. My first top 5 way to know whether the information is reliable is to check if the information that's being presented to you is that sponsored by someone. Okay?
Like typically like by a company or someone that's...
Yeah, a company, a big company or something like that. If it is sponsored, then that information may not be reliable. There may be some inherent bias to it if it's sponsored.
I think that is possible. Sorry, I just
Yeah.
got to clean my hands here. I find Purell does work nice for that.
That's the only one I'll use.
Yeah. So
Purell's the best. Purell's the best.
It is.
So that information may not be reliable if
Right.
this were being sponsored by Purell. Okay? Same thing in all kinds of medical literature. If it's sponsored by a certain company that's trying to sell something, then that information may not be reliable.
And I think something to note as a consumer of that information is that sometimes the sponsorships can be very obvious, and sometimes they can be subtle
good
or
point.
subliminal, kind of like
Good
a
point.
product placement in a movie or whatever. Like there's a million different versions of them.
Yeah.
So just beware.
Yeah.
Buyer beware. Okay, so my number 2 is that I would like to know that the information that I'm getting or consuming or going to apply is provided by an expert.
An expert.
An expert in that field.
Good, good. What's an expert in the field?
So that's a very difficult thing to define, actually.
Yeah.
So because you can be an expert in one thing and then talking about something else that maybe you're not even an expert in.
You may be a celebrity,
Yes.
and you may be telling someone to put an egg somewhere it doesn't belong, or steam an area of the body that doesn't do well with hot steam.
Okay, I was going to name a celebrity, but I'm not going to because there's a bunch of them that do stuff
You
like
have
that.
to be careful, okay?
Yeah.
There's a difference between an expert and a celebrity.
Even argue that they're
not celebrities.
No, we're definitely not celebrities. But you can even argue that some surgeons talk about things that are totally different than their regular day-to-day work, as if they're an expert just because they're a doctor. And
we do that all the time.
But usually we bring in other
When
experts.
we bring in an expert,
Right.
or we preface it by saying, "Hey, I'm no expert in this, but this is what I've learned or
Ain't
read."
no expert. Yeah.
Okay, so make sure it's not sponsored.
Yes.
Make sure it's an expert that's giving you that information.
And not just a generic expert, an expert in the field.
Yeah.
Okay, number 3.
So the third important question to ask is there a conflict of interest somewhere in this presentation, okay?
Okay.
So let's say you have an expert who is presenting you with medical information saying this is the best thing to do for this. Is there some sort of conflict of interest? Again, not easy to find, but you got to look for it.
So say if I go on like TripAdvisor, I'm looking for a restaurant, and I go to Jim's Fish and Chips, and the first 7 reviews are by Jim. And he says, good fish and chips.
Conflict
of interest. Very obvious one.
Yeah, so same thing with a practitioner. Could be any kind of healthcare practitioner saying this is the best way to treat the thing. Call me and I will do this for you and you will pay me. That's a conflict of interest because that person who's presenting the information stands to profit from you taking his or her advice.
And to be honest, I even think there can be a conflict of interest even if they're not making money from it. Just people that believe really strongly in something doesn't make it kind of right or so. So say I just invented a procedure. I'm not making any money from it, but I do it a certain way. And I tell you that this is the best way to do it. I just want even the notoriety. I don't necessarily want money from it. I just want to be famous for it or whatever.
Yeah.
Yeah, so I would agree. Conflict of interest is a huge one. Okay. That's 3. So number 4. My number 4 is that I would like to know that the information is current that I'm getting.
That's a good one.
Yeah, so this might have been the standard of care, say for medicine, standard of care like 2,000 years ago. So say like bloodletting used to be done routinely for a whole wide variety, host of medical conditions. And that was all the information they had, and it actually worked for some people for lots of different reasons. But nowadays, if someone says, well, hey, we're going to do some bloodletting today, Paul, you can't, it's not current.
No. You know, current. So if you're in 500 BC, you're sitting there Googling what's the best treatment for this terrible infection I've got, and you don't even know there's an infection in 500 BC, but
Sure.
and you come up with bloodletting, that's dated. Okay.
I think it's funny about you're talking about infections in fiber. They didn't know about that. What
That's
about
what I said.
Google, because Google.
Oh,
there's no Google.
Yeah, and Google's been around forever.
I feel like it has been.
Yeah.
I feel like it has been.
So
So you want the information to be current.
To be
and
current.
and that can be changing from 2 years ago. Like 2 years ago, stuff can be obsolete. Like things in medicine change so quickly, like in joint replacements or whatever. Like
we have some videos that we made a few years ago, and stuff's changed already. Because
Yes.
one example that comes to mind is some of our older videos. We say, "Oh, you'll be in the hospital for 3 or 4 days,"
Yeah.
or we might have said 4 or 5 days after
Yeah.
a joint replacement. That's old news. You're in the
news.
hospital for 1 day now. So I have to really correct that when people say, "I saw your video. You said I'd
Yeah.
be in the hospital for 3 or 4 days." Well, it's not now.
You're like, that's not reliable
No,
information.
no, there's a conflict of interest there.
That's right.
I'm no expert.
That's right.
What do you listen to me for?
Okay. Okay. So we want it to be current. That's number 4. And what's number 5?
Number 5 is the information that's being presented evidence-based?
Okay. So what does that mean? That's a term that you hear a lot, especially within medicine and in the newspaper and whatnot. What do you mean it's evidence-based? What does that mean?
Evidence-based medicine. It means that a treatment or a diagnostic test or whatever is being presented has been proven in some kind of study where they looked at many people to see if what they're presenting or what they're suggesting is true.
Okay.
Okay.
So a study's been done that shows that it works.
Yeah, evidence-based medicine. You can't just say, oh well, I did this, I took this medicine or did this procedure and it worked once, so I think it's going to work for you. No, you have to have a study where you've done it 1,000 times and said, look, it works 80% of the time,
Yep.
it works 90% of the time, or it doesn't work at all. And that study there's some criteria, we'll maybe make another video that looks at studies and what makes a study valid. Different questions you can ask about,
Yes.
is a study valid? But you want to make sure that there is some good medical evidence to support the medical information that's being presented.
And those studies are designed to remove the conflict
Yeah.
and the sponsoring and things like that to try to take out some of that bias.
Yeah.
Yeah.
And we don't, when we're doing our presentations, we don't often say, oh, this study, and cite the journal or cite the
Right.
article. But generally, when we are presenting our information to you, we've checked, is this the latest medical evidence that supports this sort of treatment option? Sometimes there isn't great evidence to support it. Some of the new treatments, there may not be
Yeah.
great evidence to support it. But if it is there, you want to make sure that whatever information has some evidence base behind it.
And I think that's a really important point in light of what's happened during the pandemic, right? Things like
yeah.
you advising wacky treatments like bleach or
Wacky.
taking medications that have not been approved and maybe even been shown to be dangerous in
That
certain
has side
situations.
effects, yeah.
There are certain people who are not experts
That's right.
who are
Celebrities?
not celebrity, probably,
Politicians,
yeah.
Maybe in their time were celebrities. But in any case,
Yes.
But the pandemic poses a neat problem because it happened so fast
Right.
that there wasn't enough time to collect all the evidence to drive medical decision making.
Right.
So
And that's why you have to use the best evidence, and that may change day to day, week to week, and that's why doctors would come out and say, hey, we think this is the right idea, like the masks, right?
Masks.
Wear a mask, don't wear a mask,
Oh
have
my
to wear a
God.
mask.
Wear it inside, don't wear it outside. Yeah, it's crazy. And what kind of mask should you be wearing? That changes all the time.
Yes.
Okay. So
So
those are 5. Can we recap
I
them?
think we should recap them because I
Okay.
feel like it was a lot.
So what are we talking about? We're talking about 5 important ways to check if the medical information you're getting online, just like this, is reliable.
Okay.
Okay.
So number 1, you want to make sure that it's not sponsored.
It's not sponsored by, you could get, if you do see information that's sponsored, recognize that this may be biased.
Just beware.
Okay. 2, it should be coming from an expert. Okay.
Okay.
So whoever's presenting the information should be an expert in that field.
Yes. Number 3, there needs to be no obvious conflict of interest where the person providing the information and the results directly can benefit from positive results.
Number 4 is it current? Is the information you're checking current? Is it really old news? Because stuff evolves. They say the half-life of medical information is 5 years. So 5
Yeah.
years from now, half of everything that we've told you is wrong. That's a little bit of a generalization, but is it current?
Okay. And the last one, number 5, is it evidence-based? So is it based in a strategy that looks at stuff very specifically with some guidelines to prove that treatment A or treatment B are better or worse or effective?
Evidence-based medicine.
Evidence-based medicine.
It's the thing.
It's kind of a thing. So if you like,
it's the GOAT.
it is, yes, it is the GOAT. So please, if you like it, please like it and subscribe to our channel.
And remember, you are in charge of the information you get online.
We'll see you next time.